A warm welcome and very good evening, all day participants. A resource person of today's session, respected Dr. Indranil Saha sir, and chairperson of session, Dr. Padam Singh sir. Today we are having our lecture on data quality and master chart preparation, and some portion will be covered of the remaining lecture of Dr. Shubham Pandey sir, data collection tools and response structure. Now, I would like to introduce our chairperson of the session, Dr. Padam Singh sir. Sir has held many important positions in the government of India. He has been a member of National Statistical Commission, Government of India, and has served as Additional Director General in ICMR during 1997 to 2004 and Director National Institute of Medical Statistics during 1987 to 97. Sir has worked as a Joint Advisor in Planning Commission during 1979 to 87 and a Professor of Statistics at PUSA Institute. Sir has also been awarded the Sankiki Bhushan Award and is a Fellow of the Society of Medical Statistics, which is the highest honor for a statistician. Dr. Padam Singh sir recently awarded Pandit Ramakrishna Pandey Lifetime Achievement Award from Institute of Applied Statistics in 2022. Sir awarded with Dr. P.V. Sukhatme Lifetime Achievement Award with 5 lakh cash prize from Ministry of Statistics from Implementation Government of India. With your permission, Dr. Padam Singh sir, am I audible sir?
Yeah. Yes, very much. Please.
Welcome sir, welcome sir. Now, we welcome our resource person of session, Dr. Indranil Saha sir. Sir is a scientist Center on Non-Communicable Disease (ICMR) and has been served as assistant professor at Burdwan Medical College, Burdwan, and as an associate professor at IQ City Medical College, Durpur, and ASI, PGI, MSR, and ESIC Medical College, Joka, Kolkata, and professor at IQ City Medical College also. Sir is a member of Medical Education Unit, Curriculum Committee of IQ City Medical College, and Sir is a fellow of Indian Public Health Association. Sir has judged as the best ICMR STS project in 2016 and guide of PhD thesis. Now, with the permission of our chairperson, Dr. Padam Singh, I request to Dr. Indranil Saha sir to kindly start the session. Dr. Padam Singh sir, please provide
Yes,
permission.
please. Go ahead.
Thank you, sir. Thank you, sir.
So, good evening to all participants and
Yeah,
my
very good
respected
evening.
chairperson, Professor Padam Singh sir. So I'm grateful to Dr. Singh Padam Singh sir for giving me the opportunity in this podium to present my lecture. So thank you all. So with sir's permission, I'm sharing my
Please.
screen for today's session. Okay. Thank you, sir. Is my screen visible to all of you?
Yes, sir. Yes, sir.
Okay. So today I will start the previous session, so data collection method. Later on, I will cover the little bit about the data quality part and the master chart preparation. So whenever we talk about the research design, we talk about two research design mainly. One is the qualitative research and one is the quantitative research that I have also discussed in my previous sessions. Nowadays, we often mix qualitative and quantitative research design in a single research project. So that project, that research design is known as the mixed method research. So, so separately we do the qualitative research, separately we do the quantitative research, and sometimes we do the mixed method research design. So mixed method research design where both qualitative and quantitative parts are applied simultaneously. Now, based upon the method, which method I will adopt first? It might be qualitative followed by quantitative, or it may be quantitative followed by qualitative, or it may be simultaneously both qualitative and quantitative both will carry on. So depending upon this thing, so the research design will be named accordingly. That I have already discussed in my previous class. Now, when do we require the qualitative approaches? When we aim to gather an in-depth understanding regarding the attitude, values, concern or belief, motivations or aspirations like this thing. And when the problems are ill-defined, it is not very much specified, and again it is much more difficult to apply more quantitative method. In those situations, we basically go for the qualitative research. So in qualitative research, we basically go for the narrative non-numerical value. But in contrast, in quantitative research, basically we deal with the numerical data which can be mathematically computed and can be analyzed statistically. But there is no scope in that sense in case of qualitative research. In qualitative research, mostly we are inclined with how and why. In contrast, in quantitative research, it is much more specified, something much more objective, how much and how many. So whenever we talk about the qualitative research, it is somehow subjective. The objective component somehow less compared to the quantitative research. So whenever we talk about how and why, so these are the different data collection methods that is employed in the qualitative research. They are namely focus group discussion, in-depth interviews, key informant interviews, observations, field notes, photographs, video or films, reports or media reports. So these are the different data collection methods in case of the qualitative research. In contrast, in quantitative research, more or less we are well accustomed, we know, we are quite well aware of the facts. That is, we use an questionnaire. Sometimes we have an observational checklist. Sometimes we have registers or reports, some previous register that we go through. Sometimes we go for the anthropometric measurement, like measurement of weight, measurement of height, measurement of BMI, etc. And sometimes we also go for the laboratory tests. So these are the different methods that we will describe in brief in the data collection methods. So methods of data collection, if you remember, in which part of the research project we the that for I stands for introduction, stands for methodology, RA stands for results and analysis, and D stands for the discussion. Mostly we write methods of data collection under the heading tools and techniques that are written under the methodology section. So please remember, in the tools and techniques that we adopt in a specific research design that are mentioned under the data collection, and these will come under the broad headings of materials and methodology. So data, we know there are primary sources of data and there might be secondary sources of data. What is primary sources of data? The data that are collected afresh and for the first time by the researcher is known as the primary data. And what is secondary data? The data which had already been collected by someone else and it is in the register or in the computed form, and I am a researcher, I'm using that data. The data have been collected by someone else, so for that particular person that data is the primary data. But as a researcher, since I'm analyzing that data, to me that data becomes the secondary data. The classical example is the census data is basically the primary data. But if I am doing one analysis, one project with the census data, then census data will become secondary data to me. So for primary data, what are the different data collection methods? First and foremost is the interview. Most of us, we employ interview, and as a doctor as well also, you are quite aware of the fact that whenever a patient comes to a doctor's chamber, we mostly rely upon interview. We take the history, how long fever, what is the type of fever, whether the fever decreases with medicines or not. So interview and first and foremost important weapon for primary data collection tool. Sometimes in a survey method, we also use some questionnaire. So this is again another tools or method. Sometimes we also employ the Delphi technique. I will detail a little bit about the Delphi technique. Again, another important tool is the focus group discussion. This focus group discussion is mostly employed in the qualitative data analysis, in a qualitative research. So please remember whatever I told you earlier, interview, questionnaire, Delphi method, these are for the quantitative research. And this one, what I have just now told, FGD, that is the focus group discussion, that will come under the qualitative design. Another one is the observation. It might be qualitative, it might be quantitative as well. And again is the direct physical measurement. What is direct physical measurement? That you can say as the anthropological measurement as well. Also the pulse recording, also the recording of blood pressure. right? So these will also come under the data collection method. And last but not the least is the use of standardized tests. I'm not very sure how much is the hemoglobin, so I have written that you go for the hemoglobin test, you go for the fasting blood sugar. So these are the different uses of standardized tests. So these are the different tools for primary data collection. Now I'm talking about the first one, that is the interview method. As I've already told you, in the picture you can jolly well see that one patient has come and the doctor is asking some questions to that particular patient. So interview, so please remember, it may be face-to-face interview like the previous picture. It might be telephonic interview that happened in the last 2 decades during the COVID-19 pandemic time. We have seen so many research projects, so many research findings that was based on telephonic interview, and it might be also due to the computer assisted interview as well, that we have also observed during the COVID-19 pandemic time when there was restriction, people could not come out to the out of their home. So many research that was conducted by telephonic interview and the computer assisted interview, right? But mostly we prefer for the face to face interview. So it is clinicians most important tools that I have already told you. This may be structured interview, it might be unstructured interview. What is structured interview? In the structured interview, there is a planned list of questions. So I am very much unlikely to deviate that planned list. So whatever is written, I will exactly ask the same questions in the same manner what I have jotted down, right? So question number one, question number two, question number three, question number four. So I will not ask question number two after question number one. So everything will is a planned thing, and it has been planned, it has been framed, and the same way these same questions that will be asked to the participants as well. So what is unstructured? Unstructured means this is mostly employed in the qualitative research, but structured is mostly done in the quantitative research. In unstructured, what happens? Instead of framing those questions one by one, we have some list of issues. I have in my mind, okay, I will ask regarding attitude, I will ask about motivation, I will ask about aspirations. But I have jotted down the issues. But that is not in a planned manner. In for a participant number one, I might ask emotions in the second, but another participant I must emotions at the end. So list of issues are there. On the basis of the interaction, the researcher will decide which one to put the next level. So most often used in the exploratory qualitative study. So based on the interaction, I will ask the different issues at different points of time. So when attempt is made to raise an issue rather than to provide an definitive answer, that is why I have told these unstructured questionnaire, these are mostly done in the qualitative study. So different types of unstructured interviews. So one is the in-depth interviews. In-depth interview means, you see, it is less than 100 participants, usually patients or the service users. Upon them, in-depth individual interviews are administered. Another interviews are the key informant interview. So please remember both this type of interview, IDI, IDI stands for in-depth interview technique, and KII stands for key informant interview. You see, some patients are coming in the health center. You just think about an hypothetical situation. You think about one primary health center or a hospital. In a hospital, so many patients are coming. So who patients? So patients are basically the service receiver, isn't it? So they are basically the service receiver, and the hospital staff members, they are basically the service providers. So whenever, suppose one new intervention has been implemented or new type of service delivery has been discharged from one particular hospital, right? Say for example, I have introduced some new technique, new service delivery technique in one particular hospital. Now I want to have some interaction, what they have think, what they have thought, right? What they think. So this thing in that way, basically, just a minute. Am I audible?
Yes,
Hello, am
very
I
much.
audible?
Yes.
Okay, okay.
Please go ahead.
Okay, sir. Thank you. Yes, thank you, sir. Thank you, sir. Thank you, sir. So please remember, so one new intervention has or one new initiative have been we have done in a specific hospital. Now we want to have some message about the new policy from the hospital staff as well, and from the hospital the patient, those who are coming to the hospital as well. So if I make some interviews on the service providers or the policymakers, those who are working in a hospital, that interview will be known as key informant interviews. Basically, they less than 10 individuals will be interviewed individually face to face. But whenever we want to have one impression from the patients, that is those who are beneficiaries or the service receivers, for them that specific interview will be known as the in-depth interview. Am I clear? So these are the two basic type of unstructured interviews. So please remember, in-depth interview is administered on the beneficiaries or those who are taking the service, and key informant interviews is the interview face to face, one is to one, that is done on the service providers who are providing the service. Usually in-depth interviews, these are done less than 10 individuals, and in-depth interviews, IDI, these are done less than 100 participants. Am I clear? So next, another very important, so during interview, please remember, that is very important. Interviewer should adopt a neutral stance towards the interviewee and their response in order that bias is not introduced. I have asked, do you know that for the first 6 months, exclusive breastfeeding should be done? Suppose the participant is telling, no, I am not aware. But in that time, I will not say, oh, you don't know. That's the basic thing. So in that way, I might incorporate some bias. Then the interviewee, she or he will not express his correct feeling or emotions and knowledge. So please remember, interviewer should adopt a neutral stance towards the interview, and they should practice under supervision, especially with the videotape reviews of the interview. So suppose one has assigned me to take one interview, but before that I should practice, and someone senior to me, he or she should supervise whether I am competent enough to go to the field to do the interview or not. So please remember, this is very important. Now you see, this is another type of interview. You see, this person is taking the interview. You see, another person is standing beside him, and one board is there, and you see some persons, they are sitting on a round table, or say for a square table. Basically they are facing face to face. This type of interviews, it is known as focus group discussion. So please remember, this focus group discussion is one of the important qualitative method data collection tool, like the previous one. So in-depth interview, key informant interview, and focus group discussion, these all three are basically data collection method for the qualitative research. So in focus group discussion, what happens? In IDI or in KII, one is to one interviews there. But in focus group discussion, you see, this is in-depth information on concept, perception, or ideas. So focus group discussion. So from the name it is implied, one group is there. So group member consisting of 6 to 12 persons. So please remember, the group should consist of members, participants, those who are 6 to 12 numbers. It should not be less than 6 members. It should not be more than 12 persons as well, so that a freely and spontaneous discussion will take place, and it should be guided by a facilitator. And one tool is there, that is the FGD theme. So I have told you, one person was standing and he was asking the question. Basically he is standing with the FGD theme. So what are the different plans, different things that he or she will ask? And another person, that person he was standing beside, he will basically take some notes. Suppose someone is become depressed, someone has become emotions, right? So he or she will note it down. Yes, person number 6, she was laughing when answering the question. Person number 7, he cried when he was telling his response, like this thing. So this is one of the example of the FGD themes, you see, right? So I'm not going into detail of this thing. So another important thing, since group is there, Group, number of group consisting of 6 to 12 members. So please remember these 6 to 12 persons, they should be homogeneous. Homogeneous in the sense of social class, age, level of knowledge, cultural or ethnic characteristics, or sex, etc. Recently, we have conducted one survey regarding the precautionary dose COVID vaccine uptake. We did some focus group discussion. We did it for males separately, and for females it was separate focus group discussion. So we did not mix both male and female in a same focus group. Again, you see, in a focus group, suppose there are 10 people in a focus group discussion. Some people they are highly educated, and some people they are literate. So the literate people, they will not open up their emotions, their perceptions, and their knowledge. So there should be disparity. So the basic intention of the focus group, that will be hampered. So to maintain this thing, the group should be homogeneous, that is in similar social class. Say for example, one focus group, they are consisting of members all from the high socioeconomic status, or another social group, those who are from the middle socioeconomic status, or one age. Suppose one group full of geriatric, that is the people those who are aged 60 years or more, and another group those who are the age group between 20 to 40 years, and another age group that is less than 20 years of age, so that the group homogeneity can be maintained, so that the group dynamics will be stable and will be able to extract the answers from all each of them. So this is the basic intention. So participant selection on the basis of some shared characteristics of experience. I told you now, recently we have conducted from regarding precautionary dose COVID vaccine uptake. So what we thought, we did one focus group for males, those who have taken COVID-19 precautionary dose. Again, we took another focus group, that is consisting again male participants who did not receive any precautionary dose. That is the third dose. So one focus group, all the male participants who received third dose vaccine, COVID vaccine. Another male focus group who did not receive third dose vaccine. Another female group who received third dose vaccine. Another female group who did not receive third dose vaccine. So in that way, we created different focus group. So that is meant by the second point. The discussion is planned to obtain information on the participants' belief and perceptions on a defined area of interest with open-ended questions. I told you this is an qualitative research, so open-ended will be there. Next comes to the third one, next one, that is the questionnaire. So what is questionnaire? Whenever we will frame one questionnaire, please remember this is for the quantitative research. This is for the quantitative research design. Well designed, the questionnaire, it should be well designed to get valid and reliable response. These two terms is very important. What is the valid? Validity means accuracy of answer. So that what I am supposed to know, I am getting that same answer. And what is reliable? Reliable means if I repeat the questions in different ways, every time I will get the same response. This is known as a reliable. So please remember, the construction of questionnaire is very crucial. So it should be framed in such a way that we should get valid and reliable response as well. So steps of construction of questionnaire, aims, definition of the areas, and what are the variables I should put in the questionnaire. Say for example, I am interested to study one research project on the hypertension. So what are the different questions I will put? That has to be set on by discussion with the guide and by consulting the review literature. I have to know what are the different variables upon which blood pressure is dependent. I have read that blood pressure is dependent upon the exercise. Blood pressure is dependent upon the dietary habits. Blood pressure is dependent upon the weight. Blood pressure is dependent upon the smoking status or alcohol status. So in that way, I will keep all those variables in my questionnaire. So it based upon my research topic and my research objective as well. Second one is the draft of questionnaire. So based upon my discussion with my guides, with my senior, with my colleagues, and mostly from the review of literature, I have drafted one questionnaire. Now that drafting of the questionnaire, it should be piloted. This is known as pre-testing. So what is pre-testing? The first draft questionnaire I will apply to the study participants. Please remember, say for example, I have thought that I will do the research project on the adult population. So I will apply this draft questionnaire also on the adult population, but in a same study site or something, or in a different study site. So what is the pre-testing? What is the basic intention of the pre-testing? It is basically the rehearsal of the original study. Say for example, in my room, I was sitting with so many experts, and I have framed the question. But during the trial, during the pre-testing, I have seen that one question that has given seven different response from the 7 different participants. What does it mean? It means whether my questionnaire question is good, but framing is not so specific. 7 different participants, they have understood my same question in 7 different ways, and they have answered in 7 different ways. So that means I have to reframe the questionnaire, right? So this is the basic intention of the pre-testing. That will basically identify the ambiguities and difficulties of the questionnaire. So in that way, and another one, please remember, upon whom the pre-testing will be done, those participants, they will not be recruited in the final study. That data will not be used in the final study. This is only for the rehearsal purpose. After the rehearsal is over, we will forget about them. We will not use their data at all. But accordingly to their interactions, I have to reframe the questions. So this is the basic intention of the pre-testing. So rehearsal with the questionnaire, I have told you, to remove ambiguity, that I have told you, redrafting based of the feedback if required. Second time conducted. So second pre-testing, that might be necessary, that is based upon entirely on the decision of the researcher as well. And finally, we will administer of the final questionnaire. So questionnaire administration, it might be in the two ways. One is known as the self-administered questionnaire, and second one is known as the interviewer administered questionnaire. What is self-administered questionnaire? I have drafted the questionnaire. I'm going to a village and I'm distributing the questionnaire to the participants. I have told them how to fill it up, and I'm telling them, okay, you fill it up. I will come to you later on after one day, and you will fill up the question, and I will take up the question. This is known as self-administered questionnaire. And second one, it might be interviewer administered questionnaire. What does it mean? I'm taking the questionnaire. I'm asking one participant, okay, what is your name? What is your age? What is your weight? What is your dietary habit? So what he or she is telling, I'm writing it down. This is known as interviewer administered questionnaire. Is it clear? So self-administered questionnaire, and second one is the interviewer administered questionnaire. So self-administered questionnaire, what are the benefits? Very, you can think on your own. The benefit is, it is very cheap to administer, because you see, this is very time consuming. So this is not so time consuming. It will reduce my time. I will go, I will explain to all of them, and accordingly they will fill it up. So this will not take much time. So cheap to administer. Second one, less susceptibility to interviewer bias. Suppose I'm asking one question, the participants might go for the socially favorable answer. Have you understood what is the meaning of socially favorable answer? That means if I'm asking, do you wash your hands before eating, before having your lunch, or before having your food? So if somebody says no, it actually this is the practice, then I might laugh. So, and another way, he might think that why should I tell that? He might think something else. So he will say, no, no, okay, I always wash my hands. So this is known as the socially favorable answer. So if self-administered, then there is no chance of socially favorable answer. So that is why I have written less susceptibility to interviewer bias. Next one, it can be administered by email as well. In the COVID-19 pandemic time, we have seen so many research have been conducted by administered questionnaire through WhatsApp, through Facebook, through emails, and they have told, and the participants, they have filled up, and they have submitted the questionnaire through Google links as well. So this is the benefits of the self-administered questionnaire. What are the demerits? It higher rejection rate. Suppose I'm facing some questions that I'm facing some difficulties are there. I will simply not answer the question. So higher rejection rate. Again, it is very much clear to all of you that one has to answer the question So he must have that level of literacy, that level of understanding. Suppose one for illiterate person, self-administered questionnaire, there is no this thing, no areas, isn't it? So difficult to elicit detailed response. This is another important demerits, and less control over filling of response. Suppose I have asked some question, some in-depth questions, but since nobody is supervising and I'm filling it up on, so there is less control over filling up the response. So whatever I'm feeling, whatever is coming in my mind, I'm filling it up. So less control. So I might miss the detailed response that the researcher wants. So incomplete and badly filled response. This is another important disadvantage of the self-administered questionnaire. Now, if you think about the interview schedule by interview administered questionnaire, there are different benefits. What are the demerits of the self-administered questionnaire? These are all the advantages in the interviewer administered questionnaire, like lower rejection rate, more detailed response can be elicited, greater control over filling of response form. What are the demerits? Expensive to administer, more susceptible to interviewer bias, and again it is more time consuming. So whenever we talk about the questionnaire, I'm talking about the questionnaire. So the question format, it might be open-ended question or it might be close-ended question. So what is open-ended question? From the name it is implied the the end is open. So here no predetermined response schedule is there. So it is open-ended. But in close-ended, you see predetermined list of response option is there, right? So please remember, so in open-ended means the participants, they have the liberty to respond on their own. But in the close-ended, you see, I have given some responses and they have to choose, they have to select from their own. So the response is predetermined in the close-ended. Now I'm asking you one question. So if I ask one question, why do you smoke? And I do not give any options. So this is basically open-ended questionnaire. But if I give options, predetermined options, why do you smoke? To relieve boredom, for relaxation, concentration at work, then it becomes a close-ended question. So basically, whatever question you will put, either open-ended or close-ended, it depends upon you, it depends upon the research question, and it depends upon your objective as well. So what are the benefits of open-ended questionnaire? Detailed answer can be get. So we can get detailed answers since it is open-ended. So participants, they are telling whatever responses that is coming in their mind. But what are the limitations? Sometimes on my own I am telling up my responses, so it might be less structured. Sometimes it might be difficult to encode and it might be difficult to analyze as well. So these are the demerits. Everything has some merit, has some demerits as well. Again, in contrast, close-ended response, you see, what are the benefits? It is tightly structured and easily encoded. But in the close-ended, you see, less depth of answer, and it might be frustrating for the participants because you have asked some questions and the participants is seeing that all the responses you have given it predetermined and he or she has to tick. So he might feel frustrated. Okay, so no option, no liberty was given to me to answer on my own. So this is the limitations of the close-ended questionnaire. So close response questions, so you see, they might be mutually exclusive so that only one response is possible. So whenever close response questions, it might be dichotomous. Dichotomous means only two options are there, yes or no, agree or disagree. Or the close response questions, it might be in the MCQ format, that is the multiple choice questions format. Again, it might be in a rating scale or it might be in a ranking format. Say for example, I have given you a one list. What do you think about lymphatic filariasis? What do you think about diabetes mellitus regarding elimination ranking? So somebody is telling lymphatic filariasis elimination should be kept at the first level. Somebody is telling diabetes mellitus should be kept on the priority list at the first level for disease elimination. So this is the ranking. So the closed end response questions, these are the different types of closed response questions. Sometimes we measure attitude also, and to measure the attitude, we have some scales. The most common scale that we use to measure the attitude It is the Likert scale. Another question that is being used, it is the 4-point forced choice format. I will discuss about the Likert scale and the 4-point forced choice format. So what is Likert scale? Say for example, this is the question. Do you agree that all lecture classes should be accompanied with PowerPoint presentation? This is my question. Do you agree that all lecture classes should be accompanied with PowerPoint presentation? And I have given the different choices like this thing: strongly agree, disagree, undecided, agree, and strong. This number I will not show to the analysis on the scoring, right? So this is the question. Since 5 options are there: strongly disagree, disagree, undecided, agree, strongly agree. So 5 options. So this is known as the 5-point Likert scale. It may be like this thing. It may be, it will be called as 3-point Likert scale. You see, disagree, undecided, and agree. So this is known as the 3-point Likert scale. Now, sometimes we see, since I have asked the questions to the students regarding one university or regarding one of the institute, some students, some students might be might be not so not so uh, not so come up with agree or disagree. Some students, they might take the neutral stance as undecided. Have you understood what I'm telling? If I see that as a student, if I say agree or disagree, so it is somehow against the college administration. So some students, they might think, okay, I will not go for any controversy, I will not go for agree or disagree. Rather, I will take a neutral stance. I am undecided, so that nobody will be able to scold me. Now, but as a researcher, I want one honest answer. I want for honest answer for implementation of the work. So I have seen in the pilot study that most of the students, they are taking undecided option. So what I have done now, I have removed that undecided portion. Same question, I have put 4 different options: strongly disagree, disagree, agree, and strongly agree. So I am forcing, the participants to take either agree, strongly agree stance, or the strongly disagree, or disagree options. So I am forcing that individual to stick to one options. This scale is known as the 4-point forced choice format. Why 4-point? 4 options are there. Why forced choice? Because I am forcing one individual to take one options. Am I clear? So this is all the basics and background of the Likert scale and the 4-point forced choice format scale. Now I'm coming to the next question, that is the online questionnaire. So ease of accessing the population through online approach, potential to collect huge amount of data efficiently, sorry, using minimal resources and within short time frames. So this is the beauty and advantages of online questionnaire. Again, the disadvantages, rejection might be high, badly filled up questionnaire, incomplete filled up questionnaire. These are the different disadvantages of the online questionnaire. Next is the validated questionnaire. You see, in validated questionnaire, you see some validated questionnaire you will get in the web. Say for example, DAS questionnaire, DASS, depression, anxiety, and this thing. Another questionnaire like this thing, Hamilton depression scale, right? So these are the different validated questionnaire that are available in the web page, that you can ask that particular person if it is copyright, or sometimes it is if you write to them, they will give you the permission for to use the validated questionnaire. So the questionnaire is very easy to this thing, and mostly this questionnaire is validated throughout the world, right? So in that way you can also use the validated questionnaire. So this validated questionnaire, they have the added advantage of they have the reliability, and they have also been tested for the validity. So when you some this questionnaire, So you are pretty sure and you are in advantageous position that nobody will ask you regarding the questionnaire. Yes, you have used this questionnaire. What is the validity of the questionnaire? Then you might say that this questionnaire that has been validated by this society and this validated in my country, and it is also been tested for the reliability. So automatically the quality of your data, the quality of your research automatically will be increased. So this is the beauty of the validated questionnaire. You see, some of the validated questionnaire I have written here. One questionnaire is the audit questionnaire. That is the 10-item alcohol use disorder identification test. Another one is the SF36, the 36-item short form of health survey. Right. So these are the different health validated questionnaires that are available. Next, another important one is the Delphi technique. What is Delphi technique? Opinion of experts on a particular research question is taken. So aim is to bring about consensus. So I have 5 experts, external experts, and I have framed one questionnaire regarding one subject. And I have sent all my questionnaire to 5 different experts, and they're sitting on their own home or in their own institute. They're not coming physically. So I'm sending my questionnaire to them by email, and they're giving their input, and on that basis of consensus I have developed one questionnaire. So this is the method of the Delphi technique. Next part is the observation. You see, this is the observation. You see, one person is taking one this thing lens, and he's now observing what is going on. So this is known as the observation method. So instead of asking about injection safety practice, one may himself look on the spot. If you ask, you will ask some junior nursing personnel regarding how do you give injection to the patients. Now, if you ask what is the correct procedure for giving injection, you will see each and everybody is correctly telling the exact step by step, one by one. But if you observe them, you will see some disparity. You might see some disparity. So these issues cannot be judged by asking some questions to the participants. Instead, if you can observe them, then only you can understand whether they are correctly doing it or not. So what are the advantages? Subjective bias is eliminated. What is currently happening, you can see, and independent of respondents' willingness to respond. So somebody is not willing to respond, but you can also see whether his or her practice is good or not. What are the different types of observations? It might be participant observation, say for example, or it might be non-participant observation. As a community medicine professor, if I go to one ward and if I tell all the nursing personnel, okay, I have come here to see how you give the injection to the different patients, now all of them will become conscious, right? So they will again follow the ideal one. They will not follow what they used to do in regular day to day. So this is non-participant. But if I do not tell them, if I go to the word and simultaneously I am doing some other job, but my basic intention is to observe them, then it is known as the participant observation. But if I go and sit in a chair, and from that there I am looking and observing them like this thing and this thing, so this is non-participant. This is also not good. The observation, that might be structured observation, that might be unstructured observation. Structured observation means some different items I have listed it out. In unstructured, there is no listing is done. It may be controlled environment, it may be uncontrolled environment. What is controlled environment? Say for example, I'm observing injection giving practices of the nursing personnel in a specific ward. This is in a controlled situation. What is uncontrolled observation? Say for example, I'm standing in front of a shop, and my intention is to see the shopkeeper, whether the shopkeeper is selling cigarettes or bidis, tobacco products to the minors or not. So this is uncontrolled situation. You see, so in a basic environment, I'm just observing I'm just observing whether a particular shop, that particular shop is selling tobacco products to the participants those who are aged 18 years or not. Then how can I know who is 18 years or more? Again, this is subjective. right? So this is known as the uncontrolled observations. Next is the anthropometric measurement and the clinical examination. What I have told you, suppose I am measuring weight, I am measuring height, I am measuring lung function by the these are different data collection methods. So I will have different instrument machine or the measuring tape or the functions. So standardized instruments that is to be used. I have to say, for example, I want to measure the blood pressure. Then again, I have to decide whether I will use mercury sphygmomanometer or dial sphygmomanometer. Again, whether I should use supine position or I should use the sitting position, right arm or the left arm. So everything has to be specified beforehand. And what is the standard cutoff regarding the blood pressure measurement? Whether for the diastolic blood pressure, should I consider Korotko 4 sound or should I consider Korotko 5 sound? So these are the different tips and bits that you have to remember regarding the anthropometric examination and also for the clinical examination as well. So please remember these two important terminologies are very, very important during data collection tool. One is known as the intra-observer. What is that? From the name it is implied. Observer, I am the observer. I have measured blood pressure of one person 3 times, and in 3 times I have got 3 different results. This is known as intra-observer variation. How can I reduce this intra-observer variation? By taking the average, by taking the mean, I can reduce. This is known as the intra-observer variation. But say, for example, I have gone and with me, one of my friend has also gone for the data collection. I have measured one's blood pressure and my friend has also measured the blood pressure of the same person. And both of us, we are getting different results. This is known as inter-observer variation. Is it clear? So how to reduce this inter-observer variation? Please remember, in this situation, we cannot take average. We cannot take mean. Mean or average, it can be done to reduce intra-observer variation. But in case of inter-observer variation, you have to maintain the standard uniform technique. This is the thing that you have to remember. Next, use of standardized tests for biochemical parameter, hemoglobin or urine culture. You have to apply the standardized test kits that you have to think, and you have to measure the quality as well. Now, regarding the collection, that part I just now I have completed the entire thing regarding the primary data collection. Now I'm talking about the secondary data. From where I can get the secondary data? I can get the secondary data. I have told you it has been collected by someone else, and I am using that data for my research, for my analysis. So various publication of central and state and local governments that we can take. Public records and statistics, that is NFHS data. Recently NFHS 5 data is available. So if I'm doing one analysis on the NFHS 5 data, that is also secondary data to me. Census data is also secondary to me. So research publications in the journals, we often do the systematic review and meta-analysis. These are basically from the published research. So this is also a research publications in the journals and different registers. You see, from my hospital, I can get the admission register, I can get access the discharge register, I can get access the laboratory registers as well. These are the different registers from where we can get the secondary data. So what are the advantages of secondary data? Easy to collect the data within short period of time. It is less expensive method. What are the disadvantages? Many records might be missing, incomplete or not properly written. You know that is one of the inherent disadvantage of the secondary data. Issues of authenticity of data and copyright. This is the another disadvantage. So with this, I end the first part, that is the data collection method, data collection tools in the research. Now the second part, that is not so big, that is also mostly the master chart preparation and the data quality, right? So whenever we talk about the data quality, we talk about these things: whether the data is complete, whether the data is accurate or not, whether it is correct or not, whether the data is consistent or not, and whether the timeliness is maintained or not. So mostly what happens, mostly what happens, during the data quality, I'm showing you one of the just a minute. Can you see one of my Excel sheet? Is it visible?
Not now, sir.
Huh?
Not visible.
Oh, now also not visible, na Excel sheet?
No visible. No
Yeah,
visible.
there is nothing.
It's a blank
Nothing,
screen.
no.
Blank screen.
Blind
It is
screen.
blank.
Yes.
Okay, 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 okay.
It's okay. Please go ahead.
Okay, 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 sir. Okay, sir. Okay. Now is this visible?
No, no. Now,
Acha.
yes.
Now
Yes.
screen is visible, na?
Yes, sir.
Okay, 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 okay. Sorry, the Excel sheet is not visible. So whenever we talk about this thing, we see the completeness, we see the accuracy, we see the correctness, we see the consistencies as well. So now what I was trying to show you the Excel sheet. So what happens, whenever we collect the data, mostly we collect the data on a pen and pencil. Recently in our ICMR center, we have adopted the data collection in the tablets, Android tablets. So we carry the tablets in the field and we put the data and automatically it get imported in the Excel sheet. So what happens in, suppose I have collected the data from pen and pencil. Now I have to put the data in the Microsoft Excel worksheet, or say for example some of the different softwares like SPSS software or AP Info software or Stata. So during this transportation, so many errors that might creep in. So what are those? What is the thing is the duplicate data. So what is duplication? Duplication means, say for example, I have put one person's age as 45 years, right? Again, suppose the weight, whether I should put 64, again I have mentioned 45. So this is a duplication of data. So this is one of the error that might creep in during data feeding into the Excel sheet. Sometimes the another important problem is the inaccurate data, that is the wrong information. Say for example, wrong information means, say for example, I have written body mass index. So body mass index, it should be something like this 18.2 or 15.2 or 30.2 or 40.2. But you see, I have mentioned 5.6, something like this. So this is entirely wrong information. So that is the inaccurate data. This might be wrong while imported data from the pen and pencil to the Excel sheet. So that has to be another important thing that you do. Next one is the ambiguous data. That is the data might misled heading or somehow format was wrong. Say for example, I have written the column heading is systolic blood pressure, right? Column heading is systolic blood pressure, but you see some of the information, it is coming as 46 or 45. From it seems to be I have put the weight, right? Because so misleading. So maybe the heading might be weight, but I have written as systolic blood pressure. So this is another important thing. And last but not the least is the inconsistent data. That is the mismatch. Mostly it happens like this. I will show one of the screenshot, then you will understand. You see, this is one of the SPSS chart. You see, this is the data view. Actually, what Excel sheet I was showing you, that was not visible. So basically, I entered the data from pen and pencil to the Excel sheet, and from the Excel sheet, I have copied the entire data sheet from the Excel sheet, and I have put it in the SPSS software. So this is the data view. You see age, residence, education, marital status, body mass index, systolic blood pressure, diastolic blood pressure, and hypertension category I have mentioned. You see, in my research, I have defined hypertension as systolic blood pressure 140 or more, and or diastolic blood pressure 90 or more. If someone has crossed this criteria only, then only I will put as hypertension, yes. Now those who are hypertension, yes, I have coded them as 1. Those who are not hypertensive, I have coded them as 0, so non-hypertensive, right? So say for example, this first person, he is having blood pressure 130/84. According to my definition, he is not hypertensive. But unfortunately, I have written 1. Say for example, you think I have written 1 here. So this is the mismatch. This is a mismatch. So we must be very much careful while putting the data in the Excel sheet or in the software. Unless if there is some errors or bias in this Excel sheet, you think then you will run the analysis, then you will interpret the result. The entire thing will be wrong. In spite of the fact that you did a splendid job in collecting the data, and very fruitfully, very truly you have collected the data, but somehow the correct data, it has not been put in the Excel sheet or in the statistical software, then your entire analysis, the entire interpretation will be wrong. That you must be cautious. You see, this is the data view. Now if you click this one, this is the variable view. You see, from the variable view, you see these are the different things that will come: age, residence, education, marital status, BMI, systolic blood pressure, diastolic blood pressure, hypertension. When you will copy the things and you will paste it in the data view, the data will come like this thing, but the heading will be absent. Then you have to click variable view, and then from the variable view you have to write down here age, you have to write it down. Then you scroll down, next one, next you write down is the residence, next you write down the education, marital status, you have to write it here. Then only it will be visible in the data view as well as the column heading, right? You see the type, that is also very important. When number is written, it will be taken as numeric. If instead of number the thing is written like this thing, you see, residence rural, education primary, marital status married, you see the word is written. That is why in the type view, this is residence, education and marital status, it has come as string. Have you understood? Otherwise you see all the things, these are all numerical value: age, BMI, SBP, DBP and hypertension, it has come as a numeric value. Decimal is also very important. You have to clear whether 0 decimal or one after decimal you will allow. You can manipulate here, and that is very important. Now you see, if the spaces will not be able to analyze. So here you have to click the values. When you click the values, one box will open up, and in that box, actually the laptop where I'm presenting, that laptop does not support spaces. So I'm unable to show you how did it, but I'm telling you how did I do it, right? So that everyone understand. So what will be there. You have to click this one, and there one box will come. Then you have to write 1, that means rural. Then you have to click add. Then you have to write again 2, means urban. Then you have to click add, and then you have to OK. Then you will see, then values will come like this thing. Similarly, I have put 0 for illiterate, 1 for primary, 2 for secondary, like this thing. And again you see, for the hypertension, you see I told you normotensive I put as 0 and hypertensive I have put as 1. Another important thing
Dr.
that you have to
Saha, we
clear
have to
in your mind.
conclude in 5
Sir,
minutes.
sir, surely, sir, surely, sir, surely. I will take another 2 minutes, sir. So now the last part that is very important, this is the measure. I think all of you are aware that in biostatistics, there are 4 scales of measurements. That is nominal, ordinal, interval, and ratio. So based upon your scale, you have to put it. SPSS somehow they will assign on their own, whether it is scale or nominal, ordinal, or this thing. But it is up to you. You have to decide. There is if you click here, the options will be there: nominal, ordinal, or scale. Scale means both interval or ratio scale, and nominal or ordinal. Accordingly, you have to put it here. So please remember, so numeric or string that you have to take. So decimal, basically we take about 1 decimal point or sometimes 2 decimal point if I use digital weighing machine. Then this is very important for the values, as well as I've told you, when the variables are put as string, then you have to assign the numbers 1. What does it mean 1? What does it this 2, 0, like this thing? And last but not the least is the measures. So nominal scale, ordinal scale, or the ratio scale or interval scale that you have to measure. So thank you all for your patience hearing. I I conclude my session today. So I'll be happy if you have any questions so that I'll be able to answer your queries. Thank you, sir.
Yeah, now it is open for question answers. Okay, please. You can put your question in the chat box or raise your hand.
Thank you very much, sir, for very informative session. I again request all participants, if there is any query regarding today's session, then please raise your hand or write your query in the chat box.
Now,
So
I think there is some question in the chat box.
Yes, sir. From Dr. Harini.
What is the question? I can't
Can
see.
you read out, Amit?
Yes, sir. Yes. What is the difference between accuracy and correctness in data quality?
Yeah.
Right?
Accuracy and correctness, yes.
Right.
But both looks
Both
synonymous.
are synonymous. Both are synonymous actually.
Yes, yes.
Validity, accuracy, correctness, these are all synonym words. Next question.
Please write your question in the chat box or raise your hand so I can send you a mail request.
Dr. Saha, can
Sir.
you explain some with example interval and ratio scale?
So what sir has asked, very important question. So whenever we talk about the scales, we talk about four scale. What is the nominal scale, ordinal scale, then the interval scale, and the ratio scale. So out of the four scale, ratio scale is the best. And below that, we have the interval scale. In interval scale, basically the intervals, if I start from the very beginning, I think then everybody will be able to understand. Nominal scale is basically the jersey number. You see, so many players are there in a football team or cricket team. Everybody is having different jersey number. This is basically nominal scale. The jersey number does not define anything. It's just for distinctiveness, so that we can identify that, okay, Portugal jersey number 7, it is Cristiano Ronaldo. Argentina jersey number 10, this is Lionel Messi. Something like this thing. But when we talk about the ordinal scale, ordering starts from here. So one, we can say some people are having severe pneumonia, some people are having pneumonia, and some people are having no pneumonia. This is an example of ordinal scale. Orderly we can put no pneumonia, some pneumonia, and severe pneumonia. Then but the interval between this thing, that is not specified in the ordinal scale. We cannot say severe pneumonia minus pneumonia equals to no pneumonia by the severe pneumonia, right? So this is the difference. So to get rid of this scale, we have an interval scale. So in interval scale, these intervals are very much specified. Say for example, 30 degrees centigrade and 40 degrees centigrade, the difference is 10 degree. We can say the difference of 30 degree and 40 degree is the same as 90 degrees centigrade and 100 degrees centigrade. This is the interval scale, but the interval is specified. But the problem is this: in interval scale, there is no absolute zero. The zero is arbitrary here. But in case of the ratio scale, this is a higher scale, there is absolute zero. The problem is interval scale is this thing. Since absolute zero is absent, we cannot say 100 degrees centigrade is just double the 50 degrees centigrade. We cannot say like this thing, because 0 degrees centigrade does not mean absence of heat, because it is the freezing point of the water. But in case of the ratio scale, there is presence of absolute zero. We can say, yes, somebody is having pulse rate of 120. He is having twice as the pulse rate the person who is having pulse rate of 60 per beat. This is the beauty of the ratio scale. This is the difference between the interval scale and ratio scale.
Okay, ठीक है, Dr. Saha. Any other questions?
Dr. Sonia Askale, please ask your query.
Yes, sir, I would like to ask if there is any methodology of standardizing a questionnaire, or if there is interdisciplinary study which is going on and we have to assess different elements and compare the results of them individually. and then the final result can be correlated. So is there any specific attributes which we need to focus in this, or how to validate the questionnaire is basic question.
See, you have a very good question, madam. So one thing is this thing, you can use already validated and available questionnaire that you can use. But if you don't want to use validated questionnaire, instead what you have told, you want to develop one questionnaire and that should be validated, right? So there are different methods, and that procedure is something very cumbersome. Then you have to take different experts, and based upon these things you have to take different attributes, and accordingly you have to develop the questionnaire. And after that questionnaire, you have to apply it to some pilot study you have to do, say for example 200 or 300 people, and then you have to see the validity and reliability of the questionnaire. There are different types of validity, different types of reliability is there. If all the reliability and validity, all the components are met, then only you can say yes, your questionnaire is validated in your settings.
So, I would like to ask a intermediate question in this. How many number of experts should be there? Is there any protocol as such for validating a questionnaire, or how, means how we can put it up in front of our examiners that we have validated our questionnaire with the help of these guide or
Right, ma'am. Another important question, ma'am. Very
Okay.
good question. You see, there are two types of
Very,
validity.
very
One is known as
practical
the
issue. Yeah.
very practical issue. So, ma'am, you see, there are two types of validities there. So, one is known as the phase validity. Suppose I have developed one questionnaire, and Padam Singh sir is the ultimate boss in the field of statistics. He was an additional director general. Now I have included Padam Singh sir as my expert, and sir has also said, okay, you can also take some of the other experts, and sir has also suggested some names. Now I have taken. Now how many numbers, that is not clear. That is up to you, and that is based upon the expert. Some expert will say, okay, I think 5 of us are enough, and sometimes it might be said that 10 of us are not so sufficient. So it depends upon that specific part, right? And you have to take that specific expert. Say for example, you want to do one study on the mental health, so some psychiatrist should be there. And since you want to do some reliability, validity, some epidemiologist, some statisticians, he or she should also be there in your team, right? This thing. So there is no such specific number that I will say yes, 2 is enough, 3 is enough. No, I cannot say like this. Say for example, I'm telling you one mental health questionnaire, you are having some different components, like anxiety, like depression, like mania. Now some psychiatrists, they are only expert of mania, some psychiatrists they only have about anxiety. So you can take individual experts from that domain as well. So it is based upon you and based upon this thing. There is
Yeah.
no state cut
It
answer.
depends. It depends how
Right, sir.
and your objectives and all related details. It's not that simple to answer. As far as pilot is concerned, the pilot is also to be done on some minimum number.
Yeah.
That is also there.
Right, sir. Right, sir. Also there. Right, sir. Right, sir. Right, sir. Actually, some formulas are there. This is known as the Buderer's formula. I think Padan Singh sir has also some publications I have seen. So regarding sensitivity and specificity, these are some Buderer's formulas are there for diagnostic test also.
Yeah.
But in for reliability, validity, basically, you see again there is no such number. What is said that if the number is more, then the reliability, validity will be good, like this thing.
Okay, sir. Thank you.
Good.
Yeah.
I think good questions.
Yes, sir.
Dr. Dharmen Kumar Pandey, please ask your query.
सर ये फोकस्ड ग्रुप डिस्कशन जो हम लोग करते हैं तो उसमें आपने बताया ग्रुप शुड बी होमोजेनस। सर इसको एक बार फिर से एक्सप्लेन कर दीजिए।
Right. So again, you have asked very important question, Pandeyji. So what I mean to say, you see, this is a group. When I talked about in-depth interview, वो है अलग से 1:1 में हम interview कर रहे हैं. The same is being true for the key informant interview. But when we talk about a group, वो ग्रुप में हर आदमी को रहना चाहिए and हर आदमी को participate करना चाहिए. So हर आदमी will be able to tell his or her own words. Now, if the group is not homogeneous, say for example, say for example, in this today's discussion, I see now there is 134 participants. Say for example, this is one group. Now you have included some of your undergraduate students in this class. Do you think the session would be useful for them? Not at all.
No, sir. No, sir.
So what I mean to say,
it homogeneous is in terms of your target group. If you are
exactly,
focusing on adolescent girls, so the FGD has to be with adolescent girls only. You cannot include a boy, or you
Right,
cannot
right.
include an elderly woman. Okay,
right, sir,
so that
right.
is the he meant by homogeneous.
Homogeneous.
Okay, so that way it is homogeneous.
Right.
Homogeneous does not mean they have to have same opinion. No, they
No.
may have different opinion. They may have different responses. That
Exactly.
homogeneity was in terms of that.
Exactly. What I told you now, recently we have concluded finished one study, that is the third dose COVID-19 uptake, yes or no.
Yeah.
So we took one male group, those who have taken all third dose.
Yeah.
Another focus group, male group who did not take the third dose. Female group, all who have taken the third dose. Female group, all who didn't take the third dose. Again, the homogeneity is another thing is this thing. Say
Yeah.
for example, for socioeconomic status, all of them should be of the same socioeconomic status in one group. Say for example, you have thought you will do 3 focus group discussion with 30 participants. Now you have to clear that 30 participants, 10 participants upper socioeconomic status, 10 participants middle socioeconomic status, 10 participants lower socioeconomic status. So you create 3 different group with 3 different homogeneity.
Yeah.
Say for example, I have created one group. In one group, I am having 3% with high, 3% with middle, 3% with low. That is not approved. Understood?
Yeah.
So these are the things, homogeneity.
Okay.
सर इसका
I hope
इसको
you are satisfied with the response.
सर मैं एक बार फिर से बताना चाहूंगा, जैसे अगर हम अस्पताल के अगर 5 कर्मचारी हैं और हम लोग जाके किसी गांव में 50 लोगों का इंटरव्यू कर रहे हैं, तो होमोजेनेसिटी का मतलब है कि जो 50 लोगों का इंटरव्यू लिया जा रहा है।
नहीं, इंटरव्यू के लिए होमोजेनिटी नहीं है भाई, इंटरव्यू के लिए एफजीडी के लिए बोल रहे हैं। वो 1-to-1 इंटरव्यू करोगे, इट हैज टू बी spaced in the whole village and all that. It has to be representative of that. Okay, वहाँ homogeneity की बात नहीं हो रही है।
Is it clear, Pandit ji, what Sarah said?
Hello.
For 1:1, hello. For 1:1, there is no. You have to don't think about the homogeneity.
You cannot have. It has to be representative. जहाँ पर आप सर्वे कर रहे हैं, जिसने सैंपल लिया है, it has to be representative. Okay, of all socio-economic groups. Okay, and things of that type. So it is not meant that way. Homogeneous उसमें नहीं है.
But whenever we're talking a group, in that group to maintain the homogeneity. In that group, you take all the males, you take all the females in another group, you take all high social status in one group. In that way, ताकि हर आदमी in that group में बोल पाएगा freely. Right? See, for example, I'm a person from very low socioeconomic status. तुम मेरे को एक ग्रुप में बैठा दिया जहाँ पे सब लक्ष्मी मित्तल है, जो वहाँ पे सब अडवाणी है, अदानी साहब है, तो वहाँ पे जाके तो मैं कुछ बात नहीं कर पाऊंगा, तो मेरे को डर लगेगा, अरे बाबा इतना बड़ा बड़ा आदमी है, मैं तो इतना छोटा आदमी हूँ, so how can I say? So that means homogeneity is not maintained in this case, right? So that is the thing that I meant to say. What Sarah very specifically said.
Okay, sir. Thank you, sir.
Okay. Amit, you can thank the speaker now.
Thank you very much, sir, for very interactive query session and very informative session. I hope that all participants get answers of their queries. If there is any remaining query, then please write your query on given mail ID. I already shared in the chat box. You can send us the mail ID. Yes, sir, please, sir.
I have one request to you. My another class is left on 14th, isn't it? 14th of March.
Yes, sir. Yes, sir.
Yes. So it would be helpful for me if the classes is scheduled on 14th only from 5 to 6.
Definitely, sir. Definitely. I will message to all the participants regarding this.
Or 4:45 to 6. I think that would be best for me.
Sir, please send me the best time. I will share with the participants.
Okay, great.
Now I would like to request our chairperson of the session, Dr. Padam Singh sir, kindly conclude and share some views regarding today's session.
No, I already said this has been a very informative and interactive. I
Yes,
have seen many other sessions, Dr. Saha.
yes,
There were no questions. If there are no questions, I feel very uncomfortable. Okay? That means maybe no message has gone. But here, I think there were questions, and these questions were very important, very relevant.
Yes, sir. Yes.
And you are able to explain in very simple terms, whatever was asked by them. So
Sure.
let us thank the speaker, Dr. Saha, okay, for making this session very lucid, very simple, and very interactive. Thank you.
Thank
Thank you, sir.
Thank you. Thank you very much, sir, for your kind words and for your valuable time during the session for guiding us throughout the session. Now, I would like to thanks again to all the participants presented in the session. And on the behalf of Institute of Applied Statistics, we convey our sincere thanks to our resource person of the session, Dr. Indranil Saha sir, and chairperson of the session, Dr. Padam Singh sir. On the eve of Holi, on the behalf of Institute of Applied Statistics, we are wishing a very warm and wonderful Holi to all of our respected dignitaries and the participants. May you have the best of the time celebrations with your loved ones on this special occasion. Happy Holi and Happy Holi again to all of our respected sirs and participants on the occasion of Holi. And tomorrow and day after tomorrow, 2 days is off and there is no session. On 9th, there is a session on descriptive statics presentation of data by Dr. Atul Juneja sir. And we again meet at 9th March at 6 p.m. with Dr. Atul Juneja sir. And that's this presentation of data. Now, this is the end of today's session. We again thanks and happy Holi to all the participants and our respected dignitaries, sir. Thank you very much.
Thank you. Thank you. That's purely to all. Thank you.
Thank you, sir.